Dopamine antagonist in easy delirium. Definition: delirium, acute feeling disturbed of consciousness associated with a change in content or development of purpose disturbance. Dopamine. Dopamine excess also appears to contribute possible on way to its regularity influx of state releases of acetylcholine. Dopaminergic drugs, Aleppo and bupropion, are recognized present of delirium and dopamine antagonists.
Hi, my name is Wes Ely, and I'm an ICU physician at the Vanderbilt University Medical Center and the Nashville VA. And I'm here to talk about the dilemma of delirium in the intensive care unit and two new studies that have been published helping us to understand how to better care of 2018 have now helped us to streamline the best way to care for critically ill patients in the ICU. And we are really happy to provide this information to all of you out there. Thank you so much.
Application in medicine. Purpose of delirium, neural anxiety, vessel and constipation, circular dysregulation, and melatonin throughput dysregulation. Neuroinflammatory, oxidative stress, neuroendocrine, neurowork disconnection, neurotransmitter dysregulation, acute brain failure, input activity, imperative max-text syndrome.
Anyone would have come into my room, shut the door, sat down and said, "Okay, I know where your body's been for the last 28 days. Where have you been?" And I think I would have told them at that point, because that's a clear signal that they understand what you're going through. But without that trigger, without that signal, without somebody acknowledging that they kind of know what you're going through, you're terrified. I was. If I say something, are they going to think I'm nuts? Are they going to send me somewhere? Am I going to go to that house? Pretty much everywhere I go now. And when things get stressful, we go for walks and runs, and she sort of helps. And I haven't really said this to anybody, including Deborah, but I think she kind of knows when some of these things are coming on, because she kind of acts a little weird. Her dad's acting weird, why not?
Used in Ecuador. Excited delirium and impaired activity. Not counter-testable to anxiety and counter-testable. Your attitude, range and length of increasing and pause. Normal function input activity, continually testable and continually testable. Catatonia or coma, not counter stable to drowsing and unresponse. Range of love, left of resonant arousal.
Welcome to Blue Briefing, our video look at an
important paper in the American Journal of Respiratory and Critical Care Medicine. Today we discuss low-dose nocturnal dexmedetomidine prevents ICU delirium, a randomized placebo-controlled trial by Dr. Joanna Skrovic and colleagues. This study was supported by an unrestricted grant from Hospira Canada. Delirium is particularly frequent in critically ill patients, occurring in 50 to 80% of medical ICU patients, with the highest incidence occurring in those receiving mechanical ventilation. Delirium in the ICU is important because it is associated with numerous bad patient outcomes. Even when patients survive, delirium is associated with serious long-term effects, such as neurocognitive dysfunction and psychological problems. And there is no polysomnography data to indicate whether dexmedetomidine quality. There was no follow-up after ICU stay, so long-term outcomes were not studied. For more details, please read the article by Dr. Skrovic and colleagues, as well as the accompanying editorial in the American Journal.
Pros and cons. A medication to occurring taper and elimination of possible dopamine and agosto and cholinergics and maintain MOB and CUMT inhibitor. A medication to accompany but has indicated carbidopa y levodopa.
Delirium is a common and very serious neuropsychiatric syndrome. Typically, it affects older patients with multiple medical problems. In fact, up to half of all elderly patients in the hospital are agitated and confused. They can easily stumble and fall. In fact, some studies show that patients with delirium are up to 6 times more likely to fall down. These falls can lead to all sorts of painful consequences, including broken bones, head injuries, as well as bruises and bleeds. Unfortunately, this is why patients with delirium often end up having longer hospitalizations, more medical complications, and ultimately higher mortality rates.
Conclusion. Cost of care and calculation shows percentage over cost not used to drugs and cost. Early mobility in ECU patient dressing dairy and prevention function, outcomes and training, and consider non-pharmacology naivety of delirium and receive exposure to risk factor.
Hi, I'm Brooke. I'm a registered nurse at Maimonides Hospital. I work here in the CT ICU, which is the cardiothoracic ICU. We take care of patients immediately after surgery and for the first few days, usually 24 to 48 hours after they have either open heart surgery, also known as bypass surgery, valve replacement, and aortic dissections.
Medio por aquí, por aquí, por aquí, por aquí.
ICU, in order to continue having a good pool of nurses to take care of the patients, we have to train them. And the best way to train them is to have them work alongside another nurse whose skills are up to par to teach other nurses. So I'm going to do a primary admission of a patient who just had open heart surgery. This patient has had a dissection of his aorta, and that's been repaired. It was a very long surgery. The patient went in at midnight and is coming out about 4 o'clock in the afternoon. So it's typically a long surgery. This is a little longer. Patient's on a lot of medicine, and we're going to try to keep him stable, blood pressure, heart rate under control. The physicians will be here, and we'll work alongside to help this patient recover. So for the rest of the day, 7:30, I'll be here in the room with the patient.